Here on The Colour of Country Life, great to be chatting with Penny Pratt, the Shadow Minister for Regional Health Services. How are you today, Penny?
I'm really well. Good morning, Ricky, and to all of your listeners.
Yes, and just briefly, good to be talking with you after your victory in Frome as well. Congratulations on that front.
Thank you so much. It's a real pleasure to speak with you, and I look forward to many opportunities to put forward issues that relate not just to the electors of Frome, but all regional South Australia.
Well, and on that note, look, Frome is a little closer to Adelaide to say out on the Eyre Peninsula on the west coast and down in the southeast, but nonetheless the Patient Assistance Transport Scheme, something the Liberal Party promised before the election it would improve, but the Labor Party doesn't seem that interested.
Look, it's been a really disappointing budget handed down by the state Labor government, and I wanted to talk to your listeners this morning about Chris Picton, the Petrol pirate, in regards to the Patient Assistance Transport Scheme. It's affectionately known as PAT, and anyone who lives in the country who's needed access to critical care in the city will know all about PATs. For those who haven't heard about it, it's a scheme that at any one time supports about 200 patients from regional and rural Australia where they need to travel more than 100 kilometres to specialist care. Now, more often than not, that means coming to the city. And the opposition have called on Labor more than once to address this cost of living burden on regional South Australians. I put a question to the Minister just recently in the House, ahead of the budget, of course, calling on the Metro Malinauskas Labor government to match the Liberal election promise of doubling this rebate. So under the former Labor government, families or patients could access a 16-cent rebate. We know that those costs have dramatically increased, and the Marshall Liberal government made an election promise that if we were re-elected, we would double that rebate, Ricky, to 32 cents per litre. What really concerns me is that where the federal Labor government are signalling that they will not extend the fuel discount we're currently benefiting from, that was Prime Minister Scott Morrison's decision, so 20-cent discount, federal Labor aren't going to extend that after September. So we're just seeing layers of costs being laid down or hitting hip pocket of ailing patients in country South Australia.
Well, when we saw the election promise, not only from the Liberal Party, but a number of the MPs from regional areas came out on this one. We spoke to Sam Telfer, for instance, now the re-elected member for Flinders.
Yes.
And look, we couldn't get any commitment from the Labor Party on this front, but now you've noted that Eddie Hughes, the member for Giles, is a supporter of increasing the PATS rate. Indeed.
It's interesting to see, again in the House, where we all had an opportunity to speak ahead of the budget, that Eddie Hughes, the member for Giles, so that's the Whyalla district, for want of a better geographical term, even Eddie has called for reform to this patient assistance transport scheme. And it's because every country MP understands that any subsidy, any easing of cost of living pressures to country people makes a big difference. And, in his own words, he called on his own government to look seriously at PATS, understand that country people or people who live in country electorates are disadvantaged, and they're always out of pocket when it comes to travelling to Adelaide. And Ricky, of course, it's not just the fuel impost, but there are accommodation costs that go along with this.
Now,
yes.
Yeah, sorry. You used some colourful language there, referring to Minister Picton as a petrol pirate. Brings sort of images of X marking the spot. The Liberal Party, during its time in office, didn't increase the PATS rate. Was it something that was actively considered to do instead of an election promise to actually do it while you're in government?
Look, I think that's a really fair question. We were in government for 4 years, very busy in making sure that we were investing in rural South Australia. I note across the mid-north over $100 million was invested by the Marshall Liberal government in local progress associations like pools, schools and clubs. But to your question, where was the opportunity for the Liberal government to to extend that at the time. I can't speak to what was happening in Cabinet in those 4 years, but as the Liberal candidate campaigning in Frome, it was clear that country candidates and MPs were calling for this rebate. We've been watching costs increasing. We've been watching costs increasing, and I know that voters in Frome are certainly concerned and raising with me that their household grocery costs are increasing. We know that as of this weekend, fuel prices, certainly in Adelaide, has hit 224 cents per litre. It's just quite a shocking rise. If you live in the country, I've been looking on fuel apps, Ricky, as of this morning. Port Augusta, Eyre Peninsula, Southeast, still sitting just under $2, but a patient using the PAT scheme is probably going to have to fuel up twice. So we brought this to the electors because we knew it was important, and a doubling was certainly going to make a significant difference, so 32 cents per litre. And as I said before, I took the opportunity afforded to me in the House to advocate not just for residents of Frome, but all regional South Australia.
Now, Penny Pratt,
Yes.
We're talking to Penny Pratt, the Shadow Minister for Regional Health Services. What response we did get from the government before the election on this PATS issue is they seem to want to angle the debate towards how they were going to invest in hospitals and health services in regional South Australia instead of increasing the rate. Have we seen adequate investment from the state government in regional health services in this budget?
No, we haven't. No, it's inadequate. It's an adequate response. The answer that Minister for Health, Chris Picton, gave to me in the House was to laugh outright at the suggestion that they might even consider doubling this cost of living measure for ailing patients, that their plan, the Metro Malinauskas Labor government plan, is to invest in health services closer to home. Now, I welcome that. I've been campaigning and calling for that, and I will continue to. Of course, we want to see government funding invested in health services closer to home. But when we look at the budget, the Labor government are asking patients who are sick now to wait another 5 or 6 years. So they have made commitments to regional hospitals, and I really do celebrate money going into country health. So for some examples, Ricky, Kangaroo Island Hospital, Port Pirie Hospital, Port Augusta, Mount Barker, Mount Gambier, just to name a few. But the budget is very clear that the bulk of that funding has been pushed to the out years. So while these projects may be commenced sooner rather than later, the completion dates, the estimated completion dates, sit in the out years of 2026 and 2027. We will have gone to another election, state and federal, and I think it is unreasonable and heartless for this government to say we're not going to increase the fuel subsidy for the PAT scheme because we're going to invest in country health services in 4 or 5 years' time.
Now, I'm happy for you to take this last question on notice because maybe Ashton Hearn, the Shadow Minister for Health, patch, but was there anything in the budget regarding the Barossa Hospital? I thought Labor said in local media they were going to match what the Liberal Party had committed in terms of purchasing this land for it. Was there any more in the budget about that?
Look, I'll do both of those things. I will encourage you to invite the Shadow Health Minister on, Ashton Hearn, because we're working closely as a health team across all of the health services. But the short answer is yes, the Labor government have identified as a target to complete a business case for the Barossa Hospital. But that is something that Ashton was campaigning hard for during the last 12 months. For the first time ever, I understand she was able to achieve funding in the budget. So this wasn't just a conversation, but a budget commitment. And I certainly would encourage you to raise that with her in the broader context of infrastructure investments.
Shadow Minister for Regional Health Services, Penny Pratt, thanks so much for joining us today. We'll catch you again soon.
Thank you very much, Ricky. Have a great day.